not to call anybody out, but I'm calling you out. If you say I average about 8 patients a day, I'm sorry, but you probably don't. It's just the way it works. You remember the most common. So if you most commonly see 8 patients a day, that's fine. I would lead with I most commonly see 8 patients a day, because the only way you know if you actually average it is if you keep track. We know as behaviorists, self-monitoring is key in basically any behavior change. And if you want to figure out how many calories am I actually eating, you got to write it down. If you want to figure out how many warm handoffs am I actually having, how many total visits am I actually having, you need to write it down.
It's so interesting, and I would imagine this video is probably not going to get a lot of likes, or people are going to be into it. Get some unlikes.
Dislikes.
But I think it is something, and I think it's something that, I don't know if it's just because maybe psychology, we're not used to this as much, but in medicine, this is a very common thing about productivity and having metrics and having them be accurate. And it's a vital thing, and this isn't something that I think organizations should have run from. And when I say organizations, BHCs, shouldn't run from.
They should not shy away from.
Correct.
If you do not document your work.
Correct.
And people say, oh, BHCs, you're doing just fine the way that you are. You do not ever get the credit, because they can always say, oh, well, you're not contributing this amount. By keeping track, you actually get to show objectively what you're worth.
I just had this conversation with a clinic about this, and we were going over the metrics and different things. And the one thing we hear about this clinic is like how busy it is. It's like it's always just busy. There's handoffs coming left and right, handoffs are being missed left and right. And it's like, okay, the interesting thing though, when we looked at the data, the productivity was decent, but the handoffs were really low, and it was like, what's going on? And we kind of, I took the data to the BHCs, and they were like, yeah, it just doesn't seem right. It just doesn't seem right. And I said, well, self-monitor it. Self-monitor on your own versus what we pull from the metrics. And the metrics are right. And I think that's the thing that you were talking about, is that if we don't have this objective data, our subjective mind will remember the day that we got blitzed, it was a really busy day.
Well, it's not that hard. If you have, as far as a half day, if you have 3 handoffs, 3 handoffs, 3 handoffs, and then 0, that means you had 9 handoffs in 4 clinics.
Right.
So it easily drops all of a sudden, I averaged 3. Well, no, if you look at what is it, 2 slightly over 2. So just right there, because you're going to forget about the day that you didn't have any handoffs.
Correct.
So.
Yeah.